So, our study was examining static and dynamic balance deficits in the older population on Smartcells compliant flooring versus standard flooring. So, just to introduce what our study was, Smart Cell flooring is a type of compliant flooring designed to reduce force transmission. A reduction in force transmission is potentially advantageous for the 50 to 90-year-old population as the risk of falling increases as age increases. As a result, this may reduce the risk of injury due to fall. The purpose of the study was to examine the effects of alternative flooring on balance and gait using smart cell flooring compared to a standard flooring surface in a populations of subjects ranging in age from 50 to 90 years old, both on and off smart cells flooring to determine if flooring type impacted balance and gait. This was assessed by measuring static and dynamic balance during standing and ambulation, respectively, via functional assessment measures.
So the exact methods of our study were as follows. The participants were screened for inclusion and exclusion criteria and were also provided written consent and detailed descriptions of the testing procedures and all the related information. After that, SEMG sensors and IMUs were placed on the subjects in predetermined locations. Once sensors were placed, a kinematic calibration for the testing equipment was performed. The participants were then asked to complete the Berg balance scale and gait activity on both the compliant smart cells and non-compliant standard flooring surfaces. The initial flooring type used with each subject was randomized. The study participants were provided with copies of the completed informed consent and results of their balance testing at the end of the testing period. As you can see, there are pictures of our setup with both our runway and 2 chairs as per the protocol of the Berg balance scale.
Through our data collection, we had a total of 8 subjects from the ages of 51 to 81 with a mean age of 70.3. The data collected from elements of the Berg were included along with a straight gait analysis, and those were analyzed using a Wilcoxon signed rank test. And then after correcting for type 1 errors, no significant differences were found between our standard flooring and then the Smart Cells compliant flooring. We listed some of the significant trends in the data prior to the correction that were present, particularly during gait, single leg stance, and static standing with eyes open on the next column. Some of the gait differences that were found included right stance duration and percentage that were increased, along with the decrease in right step length and swing on the Smart Cell flooring. And comparatively, left single leg support was decreased also on Smart Cells, along with overall double leg stance time.
During static standing with eyes open, it was found that the participants had increased lumbar flexion on the smart cell compared to standard flooring and decreased right thoracic axial rotation. For single leg stance, they exhibited decreased left lateral gastroc activation during left single leg stance on the smart cells flooring, increased lumbar flexion during right single leg stance on smart cell, and decreased left hip flexion during left single leg stance on smart cell.
Looking at the discussion and conclusion, we found that there was no significant difference in gait, joint kinematics, or muscle activation values during gait and balance activities between the smart cell and standard flooring. We did find that smart cell flooring may be a good alternative flooring surface on which to complete rehabilitative activities, given that previous studies have shown it distributes force and may result in fewer instances of injury if falls do occur.
Now, that being said, we did notice some possible trends towards longer stance times, which also we also noted increased right step length and double leg stance time during gait activities on the smart cell flooring as opposed to the standard flooring. We also noticed some differences in joint kinematics and muscle activation during static and single leg stance activities. Due to these trends, as well as some limitations in our study, such as the smaller sample size and a limited age range, we do believe that further research is warranted to investigate these findings. That being said, that concludes our study and presentation. We want to give a quick thank you to all of our participants and a thank you to you all for your attention. And lastly, I do want to thank SmartCell for their contributions to this study.